I have spent over 30 years in emergency rooms, and I need you to listen very carefully. Most people over 60 will not survive their first heart attack if they are completely alone. This is not meant to scare you. It is a stark reality. Almost half of all heart attack deaths occur before the patient ever reaches the hospital. Why does this happen? Because people hesitate. They waste precious time. They panic, or they simply do not know the few simple life-saving actions that can keep vital blood flowing long enough for professional help to arrive. And the undeniable truth is this: if you do not know these crucial steps, you could be gone in mere minutes. Every single day I have seen patients brought into my ER who might have lived, might have walked out of the hospital if they had only done one or two things differently in those initial moments at home. That crushing pain in the chest, the sudden breathlessness, and unexpected wave of dizziness, that cold sweat. By the time many arrive, the golden window of opportunity has tragically slammed shut. But here is the profoundly good news. There are scientifically proven techniques, simple yet powerful actions you can perform right now, even if you find yourself completely by yourself, that can significantly double your odds of survival. These are not unproven gimmicks or old wives' tales. These are real evidence-based strategies that cardiologists themselves teach their patients. In this video, I will guide you through 7 essential life-saving tips that every senior must know to survive a heart attack when nobody else is around. These are the very steps I earnestly wish every single patient in my ER had understood and even practiced before their attack began. And just wait until you hear about number 3. It is so surprisingly powerful that research shows it can make the absolute difference between suffering permanent debilitating damage and walking out of the hospital alive and well. Most people have no idea about it, but after today, you most certainly will. All medical references and scientific studies I mention throughout this presentation are listed for your review in the description below. Before we dive into these vital tips, here is a quick question for you. How old are you? Please share your age in the comments section below. I personally read and respond to every single one, just like a conversation in my clinic, so please do not hold back. Now, without any further delay, let us begin with number 7 on our list. It is the very first step that holds the power to decide if you will make it out alive. Number 7, call emergency services immediately. Do not wait it out. The absolute first and most critical action when you feel any of the potential signs of a heart attack is this: pick up the phone and call emergency services right away. Do not wait for symptoms to worsen. Do not second-guess yourself. Do not tell yourself, maybe it is just indigestion, or I will see if it passes. Every single minute you delay, the damage to your precious heart muscle grows worse and worse. Cardiologists explain this dire truth in the simplest, most profound terms: time is muscle. The longer blood flow is blocked, the more heart cells irreversibly die, and the less chance you have of walking out of the hospital alive and with a functioning heart. Research unequivocally backs this up. According to the authoritative American Heart Association, patients who call emergency services within the first 5 to 10 minutes of experiencing symptoms have survival odds up to 50% higher compared to those who tragically delay. Yet heart-wrenchingly, many seniors downplay their symptoms. Studies reveal that nearly 1/3 of people over 60 wait more than 2 hours before seeking help, often because they do not want to bother anyone or mistakenly believe they can tough it out. That hesitation, fueled by denial or misplaced stoicism, can be utterly fatal. Picture this vivid and unfortunate scenario. A 68-year-old grandfather in Ohio felt a strange, squeezing pressure in his chest one quiet evening. He told himself it was probably just heartburn, drank some water, and sat down to rest. He waited for agonizing hours, desperately hoping it would simply fade away. By the time his worried daughter found him and called 911, the damage inflicted on his heart was irreversible. Doctors later told the family that if he had called emergency services right away, he might have survived with minimal heart damage, enjoying many more years with his loved ones. This heartbreaking story repeats itself thousands of times every year across our nation, and it is entirely preventable. So if you are over 60 and you ever feel crushing chest pressure, sudden and unexplained shortness of breath, a surprising wave of nausea, or that eerie cold sweat, act as if it is a heart attack until definitively proven otherwise. Pick up the phone and dial emergency services without a moment of hesitation. Even if it turns out to be nothing more than indigestion, you have lost absolutely nothing but a few minutes. But if it truly is a heart attack, and often it is, you have just taken the single most important step to save your own life. Recognizing the urgency and making that immediate call is the foundational act of survival. But while you are waiting for paramedics to arrive, what you do next can keep your vital blood moving and buy you even more precious, life-saving minutes. That leads us directly to tip number 6, a technique proven to keep oxygen flowing when every second truly counts. Number 6, chew an aspirin if available and you are not allergic. Once you have made that crucial call to emergency services, your very next move can be the difference between enduring life and facing death. Chew an aspirin. Not swallow, but actively chew it. Why is this so vital? Because aspirin is far more than just a simple pain reliever. It is one of the most powerful clot-fighting drugs you can obtain without a prescription. Heart attacks fundamentally happen when a blood clot blocks the critical flow of blood to your heart muscle. Aspirin works by thinning the blood and stopping that dangerous clot from growing larger, thereby maintaining some crucial blood flow until professional help arrives. The scientific evidence is abundantly clear. A landmark study published in the prestigious medical journal The Lancet found that taking aspirin during a heart attack reduced the risk of death by an astounding 23% in patients. But here is the critical catch: speed absolutely matters. The faster that aspirin gets into your bloodstream, the faster it begins its life-saving work. Swallowing an aspirin whole can take 10 to 12 minutes to break down fully in your stomach. Chewing it breaks it apart instantly, allowing its active ingredient to absorb rapidly through your mouth and stomach, lining within just minutes. In a dire situation where every second truly counts, those minutes can mean the difference between saving valuable heart muscle and saving your very life. Consider the story of a retired bus driver, 70 years old, who was alone in his living room when he felt that familiar crushing pressure in his chest. He vividly remembered his doctor's urgent advice, reached immediately for the aspirin in his cabinet, and chewed it thoroughly while simultaneously calling 911. Paramedics later told him that simple, swift action kept his blood flowing just enough to prevent major irreversible heart damage. He walked out of the hospital 2 weeks later, alive, independent, and grateful. But here is where many seniors often go wrong. They either do not keep aspirin readily available in the house, or they hesitate to take it because they are unsure if it is safe for them. If you have a known allergy to aspirin, a diagnosed bleeding disorder, or if your doctor has specifically told you not to take it, then by all means skip this step. For everyone else, keeping a bottle of uncoated aspirin in an easy-to-reach prominent place is one of the smartest and most effective emergency precautions you can possibly take. Doctors typically recommend one full 325 mg tablet chewed completely at the very first sign of a heart attack. Think of it this way: chewing that one little pill is like sending in a small yet powerful rescue team to slow down the impending disaster until the main reinforcements arrive. It does not cure the heart attack, but it can dramatically stop the damage from spiraling out of control. Acting fast with aspirin keeps the odds firmly in your favor. But surviving a heart attack alone is not just about what you take into your body. It is also profoundly about how you move your body in those terrifying minutes. And that is precisely where tip number 5 becomes absolutely crucial. Number 5, Loosen tight clothing and sit upright to help reduce strain on your heart. When a heart attack strikes, every single movement you make directly affects how much strain your already struggling heart must endure. One of the simplest, yet most frequently overlooked survival actions is to immediately loosen any tight clothing and then sit upright. Seniors often underestimate how quickly restricted circulation and poor posture can transform an already bad situation into something far worse. Tight belts, constricting waistbands, or restrictive collars compress crucial blood vessels and make it significantly harder for your body to circulate oxygen-rich blood when it needs it most in this desperate emergency. Sitting upright relieves unwanted pressure on your diaphragm and lungs, making breathing noticeably easier and dramatically reducing the workload on your already laboring heart. This is not merely common sense. It is fundamentally backed by human physiology. During a heart attack, your heart is desperately struggling to pump oxygen through narrowed or blocked arteries. Lying flat forces the heart to work even harder, especially in seniors who might have weaker lungs or pre-existing conditions like COPD. By sitting upright, preferably at a slight angle, with your back comfortably supported, you actively improve airflow into your lungs, lower the internal pressure inside your chest cavity, and allow blood to flow more effectively throughout your body. A comprehensive clinical review in the European Heart Journal specifically emphasized that positioning patients upright during periods of cardiac distress helps to significantly reduce pulmonary congestion, essentially the dangerous buildup of fluid in the lungs that makes breathing feel like dreadful suffocation. In other words, the way you position yourself can literally mean the difference between gasping for air in terror and maintaining enough calm and control to survive until professional help arrives. Take the example of a 74-year-old woman in Florida who felt chest pressure while peacefully gardening. Instead of lying down in a panic, she calmly moved to a nearby chair, purposefully loosened her gardening apron and waistband, and sat upright while waiting for the ambulance. Her doctor later told her that wise decision likely prevented her from fainting and collapsing before paramedics could even begin to administer life-saving oxygen. That tiny adjustment kept her heart from collapsing under the immense strain. It is a step so remarkably simple that many seniors unfortunately overlook it, but it truly matters. If you feel those telltale signs, pressure, shortness of breath, or that unsettling cold sweat, sit upright consciously, relax your shoulders, and free your chest and waist from any restriction. Think of it as consciously giving your heart the vital room it needs to breathe and function. This immediate adjustment buys you precious stability. But to further improve your odds, you also need to find ways to keep blood flowing directly to your brain and heart when your circulation is under severe attack. That brings us to tip number 4, a powerful physical action seniors can perform in those desperate minutes before medical help arrives. Number 4, cough strongly if you feel faint. This can temporarily keep blood flowing to the brain. It sounds incredibly strange, almost too simple to be true, but in the terrifying middle of a heart attack, actively coughing, yes, coughing, can sometimes keep you alive just long enough for help to arrive. Doctors sometimes refer to it as cough CPR. The underlying principle is remarkably straightforward. When you cough deeply and forcefully, your chest muscles powerfully contract, your diaphragm compresses, and significant pressure builds inside your chest cavity. That generated pressure literally forces blood out of your heart and into your brain, keeping you conscious and aware when your circulation is dangerously collapsing. Now, let us be absolutely clear. Cough CPR is not by any means a replacement for urgent medical treatment, nor is it a cure for a heart attack. But it can indeed buy you invaluable seconds if you feel faint, dizzy, or like you're about to pass out before paramedics can reach you. Research published in the esteemed Journal of the American College of Cardiology showed that repeated strong coughing during cardiac arrhythmias kept patients conscious and temporarily maintained blood pressure until emergency treatment could be administered. In some documented cases, patients were able to remain alert for several minutes simply by coughing every 2 to 3 seconds with deliberate force. Imagine this scenario. A 69-year-old retired mechanic in Texas felt a sudden, overwhelming wave of dizziness during what turned out to be a massive heart attack. Alone in his workshop, he remembered hearing about cough CPR. He immediately began coughing forcefully again and again, and miraculously stayed conscious until paramedics finally arrived. Doctors later confirmed that those powerful coughs likely prevented him from collapsing and suffering debilitating brain damage before they could successfully restart his heart. The science behind it is simple. Fainting during a heart attack is caused by a sudden critical drop in blood flow to the brain. By coughing hard, you create artificial heartbeats, almost like manually squeezing a pump with your chest muscles. It is not perfect and it will not stop the attack, but it keeps vital oxygen flowing to your brain long enough for professional help to take over. If you ever feel your vision narrowing, your head spinning uncontrollably, or your body going limp during chest pain, try this immediately. Take a deep breath, then cough hard and strong as if you are trying to violently clear your lungs. Repeat this every 2 to 3 seconds until the dizziness passes or paramedics arrive at your side. Think of it as manually keeping your heart in motion when it is struggling desperately. This unusual but incredibly powerful technique has saved lives. But once you have taken steps to stabilize yourself, you also need to make sure oxygen is getting into your lungs effectively. That is where tip number 3 comes in. It is another simple but life-saving habit every senior should absolutely master. Before we continue, if you are finding valuable information and insights in this video, please go ahead and tap that like button. Also, make sure to subscribe and turn on the bell icon so you never miss out on powerful health tips like these again. Number 3, unlock your door and keep your phone nearby so help can reach you quickly. When a heart attack strikes, every single second is precious. Not just for your body's internal battle, but for the brave people trying to save your life. One of the most overlooked yet critical survival steps is also one of the absolute simplest: unlock your front door and keep your phone within arm's reach. It sounds like a small detail, but in a crisis, it can undeniably mean the difference between being found in time and being tragically trapped behind a locked door, while precious, irreplaceable minutes relentlessly slip away. Here is precisely why this matters so profoundly. Paramedics are expertly trained to break down doors if they absolutely have to, but every extra barrier, every moment spent, forcing entry costs invaluable time. And during a heart attack, as we have learned, time is muscle. Studies conclusively show that for every 10 minutes of delay in receiving treatment, survival rates drop by nearly 10%. Imagine losing those life-saving minutes simply because professional help could not get to you quickly enough. Unlocking your door in advance completely removes that devastating risk. A 73-year-old widower in Arizona learned this heartbreaking lesson the hard way. He bravely dialed 911 after experiencing severe chest pain, but tragically collapsed on the floor before he could unlock his front door. Paramedics arrived within minutes but had to waste critical time forcing their way inside. By the time they finally reached him, too much irreversible damage had been done to his heart. Contrast that somber story with the experience of an 80-year-old woman in Florida who, upon feeling symptoms, calmly unlocked her door, clutched her phone, and stayed in a chair conveniently positioned by the entryway. Paramedics gained immediate access, swiftly started treatment, and rushed her to the hospital. She survived with only minor heart damage, a testament to her preparedness. The second half of this tip is just as critical. Always keep your phone nearby, especially if you live alone. Too many seniors leave their phone in another room or plugged into a charger out of reach. During a heart attack, even walking a few steps can trigger a sudden collapse. Having your phone right next to you ensures you can maintain vital communication with emergency responders, continuing to follow their instructions until help physically arrives. Some even recommend immediately putting your phone on speaker so you can follow instructions without the effort of holding it to your ear. Think of it this way: your phone is your lifeline, and your unlocked door is the essential bridge that gets help to you faster. Together, they eliminate dangerous barriers and buy back time you absolutely cannot afford to lose. Once the path for help is clear, the next crucial step is about keeping your body calm enough to survive until that help arrives. And that is precisely where tip number 2 makes all the profound difference. Number 2, take slow, deep breaths to lower stress on the heart and oxygenate your blood. In the terrifying middle of a heart attack, panic is your absolute worst enemy. When fear takes hold and overwhelms you, your body instantly shifts into a primal fight or flight mode, releasing a destructive flood of stress hormones like adrenaline. This adrenaline surge dramatically raises your heart rate, spikes your blood pressure, and forces your already struggling heart to work even harder, exacerbating the crisis. That is why one of the simplest survival actions you can take is also one of the most powerful. Consciously take slow, deep breaths. Breathing deeply accomplishes two critical life-saving things. First, it significantly increases the amount of vital oxygen reaching your blood and brain, both of which are desperately starved for fuel when circulation is compromised. Second, and equally important, it actively signals your nervous system to calm down, effectively lowering that surge of stress hormones that put immense additional strain on your heart. Research published in the Journal of Cardiopulmonary Rehabilitation and Prevention found that slow, controlled breathing reduced heart rate and improved oxygen delivery even in patients with advanced cardiovascular disease. It is not a cure, but it gives your body a crucial fighting chance while you wait for help to arrive. A 76-year-old retired nurse from Michigan vividly described how she survived her heart attack by focusing intently and solely on her breathing. As the crushing pressure in her chest grew more intense, she bravely resisted the urge to panic. She sat upright, closed her eyes, and began inhaling slowly and deeply through her nose, then exhaling even slower and more deliberately through her mouth. By the time paramedics arrived, she was weak but remarkably still conscious and communicative. Her cardiologist later told her that those steady, deliberate breaths likely reduced the intense workload on her heart and kept vital oxygen moving to her brain long enough for treatment to begin effectively. Here is exactly how to do it if you ever find yourself alone and in danger. Place one hand gently on your stomach, not your chest. Inhale deeply through your nose, feeling your belly noticeably rise with each breath. Then exhale gently through pursed lips as if you are blowing through a narrow straw. Aim for approximately 6 to 8 breaths per minute, slow, controlled, and deeply deliberate. This kind of diaphragmatic breathing not only directly helps your struggling heart, but it also keeps your mind focused and calm when panic desperately wants to take over. Think of each deep breath as actively buying yourself more precious time. Time for oxygen to reach your brain, time for your heart to ease its overwhelming workload, and time for paramedics to arrive at your side. And if there is one more habit that ties all these survival tips together, it is the last and most absolutely critical one. The action at number 1 that research unequivocally shows can double your odds of survival. Number 1, stay as calm and still as possible. Movement can severely worsen damage during an attack. When a heart attack strikes, your first natural instinct might be to move around, to pace anxiously, or even to try and walk it off. But that very instinct, however natural, can be catastrophically deadly. The number 1 survival rule, the golden directive, is this: stay as calm and as still as humanly possible. Every single step you take, every sudden movement you make forces your weakened, struggling heart to pump even harder. And during a heart attack, your heart is already fighting a desperate battle for its very existence. By consciously keeping your body still and maintaining calm, you dramatically reduce the strain, conserve every ounce of vital oxygen, and give yourself the absolute best chance of surviving until professional help finally arrives. Science explains this phenomenon with undeniable clarity. During a heart attack, blood flow through the crucial coronary arteries is either completely blocked or severely reduced. Movement demands significantly more oxygen from your heart muscle. But with its supply already critically cut off, that extra demand only increases the damage and speeds up heart cell death. A meticulous clinical study published in the European Heart Journal found that minimizing exertion during acute coronary episodes consistently reduced complications and dramatically improved patient outcomes. In plain and simple terms, seniors who stayed calm and still lived longer and fared better than those who moved around frantically in a panic. Consider the story of a 71-year-old farmer in Nebraska who learned this firsthand. While repairing equipment alone in his barn, he felt a crushing, agonizing pressure in his chest. His first thought was to climb back up the ladder to grab his phone, which was just out of reach. Instead, he bravely forced himself to stay put, remaining absolutely still, and called for help from precisely where he was. Paramedics later told him that staying still in that moment kept his heart from collapsing under the immense stress. He survived with far less damage than doctors initially expected, a direct result of his stillness. Calmness in such a moment is not just physical, it is profoundly mental and emotional. Panicking floods your body with adrenaline, which, as we have discussed, raises blood pressure dangerously and worsens the attack. By deliberately focusing on staying still and practicing those slow, deep breaths, you actively lower that hormonal surge and help keep your body stable and functioning. Tell yourself, I have called for help. My only job now is to stay absolutely still and breathe deeply. This critical mindset prevents rash, impulsive decisions like trying to walk to the door or grab something across the room, actions that can tragically trigger collapse before help can even arrive. Think of your heart during a heart attack like a fragile engine running precariously on fumes. Every movement, every unnecessary effort revs that engine faster and risks blowing it apart completely. Stillness, calmness, and conserving every ounce of energy is the paramount key to buying time. This is the final, most powerful habit. Do less, breathe more, and let help reach you. Together, these 7 tips form a comprehensive and empowering survival map. And while you cannot predict when a heart attack might strike, knowing exactly how to act can be the profound difference between a tragic outcome and glorious survival. And there you have it. 7 life-saving tips every senior must know to survive a heart attack alone. From calling emergency services right away, to chewing aspirin, loosening tight clothing, coughing when faint, unlocking your door, taking slow, deep breaths, and finally staying completely calm and still. Each action buys you precious minutes. Minutes that can literally mean the difference between life and death. Remember this vital truth: a heart attack does not always give you a second chance. But if you act fast, think clearly, and follow these crucial steps, you absolutely can survive and live to see tomorrow. The science is undeniably clear, but it only works if you are ready to act. Now, I want to hear directly from you. Where are you watching from today? And do you keep a aspirin or another emergency plan ready and accessible in your home? Drop your answer and thoughts below. We read and reply to every single comment because your story matters and your personal survival tips could genuinely help someone else in need. Do not forget to like this video, share it widely with your loved ones, and subscribe for more life-saving advice and insights. Stay safe, stay prepared, and always remember knowledge is power, especially after 60. If you have any questions or wish to share your personal experience, please do not hesitate to leave a comment below. We are always listening. Thank you for watching.